Hi, this is Mark Struthers. Today we're going to take a look at the different types of modalities and what they're used for and why. In creating medical images, we can use X-rays, gamma rays, radio frequency waves, and sound waves. Radiography, fluoroscopy, and mammography and computed tomography all use ionizing radiation or X-rays. X-ray is absorbed by the body tissues. Another means of getting information is by using a radionuclide and injecting that radionuclide into the bloodstream. This radionuclide then emits gamma or beta radiation for nuclear medicine, single positron emission tomography, and positron emission tomography, while magnetic resonance imaging uses pulsed radio frequency waves that interact with the body, and ultrasound uses sound waves, like in sonar. A medical imaging technologist is a professional who uses a variety of imaging technologies to create visual representations of areas inside the body. As we discussed, different modalities have different ways of interacting with the body. Here we take a look at the different types of modalities and the images they produce. We can see MRI images, X-ray images, computed tomography images, positron emission tomography images, ultrasound images, and even histology images. Technologists acquiring these images usually have to have a certification in each area that they are utilizing a different modality. Not all medical imaging technologists begin their career as radiologic technologists. Some begin their career as nuclear medicine technologists or sonographic technologists. Each technology has its own area of education for didactic education and clinical education. Upon completion of this education, you can apply for a certification in that modality. Several technologists are multimodality technologists registered in more than one imaging modality. Each of the different modalities has a scope of practice that is commensurate with the education and training the technologist received utilizing that technology. So what would you like to know about each of the modalities? You could get a short history of each modality, the theory and the physics, image formation, and on and on and on. We're just going to do a really quick overview of the different modalities. For more information on details about different modalities, you can search my channel, Mark Struthers, for other presentations. Most imaging is necessarily an aid to diagnosis. Our aim is to better understand digital concepts for imaging. Technical aspects of imaging, which have been greatly simplified here, only serve to facilitate the understanding of the imaging process. Remember that in dealing with this topic, some theoretical considerations have been simplified. The aim here is not in-depth technical expertise. This is especially true of concepts in physics. There was a time in the not-too-distant past when conventional X-ray images were the only means of visualizing the interior of the human body. Imaging was then called radiography, and the study of normal or diseased body was radiology. Oh yes, we did have sometimes imaging utilizing radionuclides called nuclear medicine scans. The overall objective of medical imaging is to acquire useful information about physiological processes or organs of the body by using external or internal sources of energy. Capturing this data from the interaction of the energies, we can create medical images from the data that we've captured in digital imaging. The modality may apply external energy to the body. Or the modality may collect energy that's being emitted from the body. External gives us anatomy, internal gives us physiology. The next important consideration is the principle of imaging to be used for obtaining the data. For example, X-ray uses ionizing radiation. On the other hand, nuclear medicine, single photon emission computed tomography, and SPECT use gamma emission resulting from interaction of radiopharmaceutical substances with the target. When we talk about MRI, we're talking about using pulse sequences of radio frequencies, and when we're talking about ultrasound, we use sound waves. Although the digital process of creating an image from the acquired data is similar, the techniques for each modality dramatically differ. The instrumentation used in collecting the data is one of the most important factors defining the image quality. Source specifications of the instrumentation directly affect the image capabilities. The data acquisition methods used in imaging play an important role in the image formation. Optimized with the imaging instrumentation, the data collection methods become a decisive factor in determining the best temporal and spatial resolution. How does the referring physician decide to request an MRI rather than an X-ray, CT, or ultrasound imaging? In general, the investigation is the simplest, cheapest, and safest. Because of the high contrast between bone and soft tissue, the X-ray is particularly useful in investigation of the skeletal system. An X-ray image of the chest, for example, reveals a remarkable amount of information about the state of the health of the lungs, heart, and soft tissue. In contrast to bone, soft tissue organs such as the spinal cord, kidneys, bladder, gut, and blood vessels are very poorly resolved by X-ray imaging. Imaging of these areas necessitate the administration of an artificial contrast medium to delineate the organ in question. In general, CT images are only obtained after a problem has been identified with a single projection X-ray or ultrasound image. CT is particularly useful when imaging soft tissue organs such as the brain, lungs, mediastinum, abdomen, and the newer ultrafast heart acquisitions. Gamma imaging or nuclear medicine. In practice, function equates to the amount of labeled tracer taken up by a particular organ or amount of labeled blood flow to a particular region when you do a nuclear imaging study. The radionuclide is usually injected into a vein and activity measured after a variable delay depending on the investigation being performed. A quantitative difference in function provides a contrast between neighboring tissues, allowing for an image to be obtained. Here we can see a list of different types of radionuclides and where they're tagged to go. In other words, we actually take a radionuclide and specifically tag it to go to a certain part of the body. Single proton emission computed tomography. This is often called the poor man's PET because it is less expensive than a positron emission tomography scanner. Like X-ray images, gamma investigations are limited by the dose-related effects of ionizing radiation and their spatial resolution. Even with tomographic enhancement, they are poorly suited for imaging anatomical structures. However, the technique has found an important niche in the imaging function of how well a particular organ is working. Well, if you have the poor man's positron emission tomography, you'd like to get the PET scanner itself. While PET has a number of theoretical SPECT advantages over SPECT, such as higher spatial resolution, and it uses a number of biologically interesting radionuclides, it has also been combined with other modalities such as CT to create a hybrid PET-CT to provide anatomical and physiological information. Finally, we'll cover the different modalities that use non-ionizing radiation, in other words, MRI and ultrasound. MRI uses radio frequency pulse waves, while ultrasound uses sound waves. An MRI has the patient enter a large tube. Inside this tube, all of the protons, hydrogen protons, in their bodies are aligned. By using radio frequency pulses, we can push these out of alignment. They then return to alignment. The energy they give off when they return to alignment is what we record as an MRI. The advantage to MRI over CT is due in part to the superior spatial resolution of the technique and in part to the fact that MRI images are insensitive to bone. This allows us to image areas such as the spinal cord. Because an MRI is basically a huge magnet, we have to be careful in how we select our patients for getting an MRI exam, especially if they have a pacemaker, artificial joint, etc. The advantage of magnetic resonance imaging is the absence of any ionizing radiation when acquiring an image. To make an MRI image, use of a static magnetic field, radio frequency waves, and switched magnetic gradients are used. There are no adverse health effects with the use of the MRI scanner, but safety issues exist because of the strength of the magnet. Ultrasound has often been used in lieu of ionizing radiation. There are several specific clinical situations in which ultrasound cannot be used around structures of bone, etc., but it is a viable option for soft tissue imaging. Unlike MRI, the equipment is portable and relatively inexpensive. It has found a particular place in imaging of pregnancy, but is also used to image the liver, spleen, and other organs within the body. Ultrasound also plays an important role in the investigation of heart and blood vessels. Well, this is Mark Struthers saying thanks for your attention and your time, and we look forward to seeing you soon.